Thank you for joining us today. While we wish we had been able to hold our celebration of nurses at the Delta Hotel, we know how critical it is to maintain social distancing and protect those who are most vulnerable. At this time in particular, we also realize just how crucial our healthcare workers really are. Without their diligence, dedication, and compassion, we know we would not be talking about reopening our businesses and returning to what we used to consider normal. Today, we are proud to introduce 5 representatives of the excellence and commitment it takes to be a nurse, now more than ever. This event was brought to you by Unity Point Health Sioux City and supported by Floyd Valley Healthcare, Mercy One, Morningside College, Briar Cliff University, and Siouxland Community Health Center. And now, we would like you to meet the class of 2020.
The role of nurses in healthcare is to be there for the patient.
The nurses play a big role in healthcare. We're the eyes and ears for the doctors. We're there with the patients 24/7, so our job is to advocate, help them through health and illness.
Nurses play a big key and part of communicating with the physicians and keeping our patients out of the hospitals and just coaching them to a better optimal health level.
There's so many different roles with nurses these days, but nurses in general are that direct link from patient to physician to help them better understand the process, period. But they're that direct link. They may be the patient, the nurse may be the one that the patient confides in the most, and the nurse then can share that information with the physician.
What's very unique to nursing is that we really try to focus in on the patient and the family members and trying to figure out what's best for everybody in that situation.
The most rewarding part, as a home care nurse, I get to meet the entire family and the patient. It's a different form of nursing compared to the hospital setting. The best part is probably when the patients come to realize how they can take ownership of their own health.
It's helping that patient understand, kind of helping them move through the whole process of everything. Because when they understand, it may not be good news, but once they understand, they can help process and deal with things a little bit better. And if they've done that, then I've done my job well, and everybody else has too.
It's watching people come in sick and alienated from their community and family, and then watching the recovery process, and then watching them leave and then reuniting with their family and being active members of the community.
I'm an OB nurse, so it's very rewarding. Helping new parents bring in new life every day is very rewarding, especially the first-time parents, meeting their son or daughter for the first time, and just being able to be a part of that is very rewarding.
I think the most rewarding is right now I have kind of 2 careers in nursing. I get to be in the hospital setting to take care of patients and once again help them get through some difficult times, especially in the hospital. You know, it's not usually a happy reason why you're in there, so giving them some joy and faith that they're going to get through their situations and help them through it is what I love most. And then I also have the pleasure of getting to teach students in nursing, and I think anybody could be in the classroom and provide them content, but what I really love is making my students laugh, getting to know them, getting to know who they are and their background story.
For a home care nurse, we really are the eyes and ears for the physicians out in the field. We are out there alone. We're in their patients' homes, and a lot of times I'll get on the phone with the physician and he'll tell me, here's what I want you to do. You know, there's no backups. It's a different form of nursing, and I think we are vital, especially now during this pandemic, to keep people home, to keep them out of the hospitals.
Well, there's always going to be people that are sick, sick physically or mentally. So, you always have to be somebody that helps out of their low point in life or through sickness or injury or whatnot.
I think it's good to honor every role, whether it's in healthcare, I think it's National Education Week or whatever. I think everybody plays an important part.
I think honoring nurses during Nurses Week is really special. They get to shine all year long, but to be remembered for one solid week and have everybody notice that is very rewarding.
For nursing, you have to have that critical thinking, that spot-on decision making, and it takes some organization. But basically, if you have a heart for caring for others and serving others in that capacity, then nursing career may be a good choice for them. And it's been rewarding for me.
I think everybody in this clinic needs to be recognized for the role they play with our patients.
On behalf of the fine folks at the Sioux City Journal and the Sioux City Journal Communications, we're honored to play a small part in this recognition. We are with Stephanie Hill. We're with Chris Van Beek, who's one of our winners. We are with Sue Legree, congratulations. We're with Greg Skolton, another one of our winners. We are with Tricia DeBoer, and you are a big winner today. Congratulations.
Thank you very much.
From the Cherokee Regional Medical Center. She's from Mercy Home Care, from Cherokee Mental Health Institute, from Judy Island Cancer Center. You are with Northwestern College and also
Orange City Area Health System.
Why did you decide to become a nurse? What was it about nursing that you said, this is the career for me?
This happened when I was in a younger age with my mom being related to cancer and her going through treatments. I was exposed to nurses in the home setting, hospital setting, and throughout her whole process, and they just really inspired me.
I knew I always wanted to do something that I could help others, and when my grandpa was in the hospital a lot when I was a child, I seen how much they were able to help him, and I knew that's what I wanted to do someday.
Nursing in the home care setting is always quite different than the hospital setting. I always say you're in their environment, you are a guest in their home, so you meet the whole entire family.
What do you do there?
I'm the patient advocate.
And what does that mean?
I meet with and advocate for every patient that comes in our door, but I meet with every new patient that walks in our door to make sure that they understand their plan, they understand where their direction's going, and if they don't, they have a personal contact for follow-up.
Helping new parents bring new life into the world is very, very rewarding, especially when it's their first one.
Are they nervous? Do they I don't know how to handle a baby. What do I do?
Some. I tell them they don't come home with an instruction manual, so there's a lot that you learn from them, and there's a lot that we're able to teach you while you're here. So,
What's the best advice you can give new parents?
sleep when the baby sleeps. Never wake a sleeping baby.
That's so great. You had a different kind of journey to get there. You didn't start out in healthcare.
Nope. I started out, I worked in a machine shop, then I went in the military.
How did you happen to choose medicine?
I'd say probably the experience in the military, we went combat lifesaver course, I believe it was called, and kind of got interested in that way with first aid and whatnot.
And mental health care, what's that like?
I like it because it's something new and interesting every day, and it's like just unique challenges. Though when somebody comes in like to a typical hospital, you see their broken leg or whatnot, and mental health, you gotta kind of talk to people to find out actually what their problem is. And I'd say seeing people come in that are traumatized and are paranoid or distraught or whatnot, and then seeing them come out and be a member of their community again.
So I've been a nurse for 37 years. I've been an inpatient nurse. I have been in managed care. I went to the research department about 18 years ago at the Cancer Center. When this position opened, I thought, I want to do this. This is what I need to do.
And has it been rewarding?
Yes, very much so.
So what I'm doing now is I've always served as that link, the eyes and ears for that physician and for the hospitals. But right now it seems like I am doing more. So the patients can't get to the clinics like they normally would due to the COVID risk. So a lot of times I'll do a telehealth video conference with the physician. They'll say, can you draw the labs? I'm drawing labs. I'm doing more than I used to for them. And they're really trusting my observing.
I'm able to, try to leave work at work as much as I can and enjoy these guys when I get home. We have a great support team at work, so we've all, kind of taken turns taking call to support the influx if and when that would happen to us.
Well, I'm proud to present you with this trophy.
Thank you.
And congratulations and thank you. That's what we really appreciate. I'd like to present you with this beautiful trophy.
Thank you.
Congratulations. Well, I'd like to present you with this trophy.
Awesome. Thank you very much.
Well, we are so thrilled to present this to you. Congratulations. I'd like to present you with this award.
Thank you so
Congratulations. Is there anybody you'd like to thank?
I would always like to thank my family. My family has always been supportive with my nursing career. It can be very challenging and frustrating for everybody back at home when mom is not home on time. So they are the ones that really, truly, they do sacrifice as well.
I, first of all, thanked the nurses that mentored me in the paper portion, and then also just my family, my husband, Brett DeVore, and lots of colleagues and everyone that's been around, and all the nurses.
I thank all of my friends and family that have been so supportive of everything I've decided to do with my career. My kids, my husband, my parents.
Congratulations.
Thank you.
I'd say my mom. I'd like to thank my mom and my wife since she's standing right here.
Yeah. Why mom?
And she was a nurse. She kind of pushed me into getting nursing after I got back. Yeah.
And so she said it's a good career to be in?
Yep.
And she was right.
Yep.
Who is responsible for you getting this achievement?
These guys and my mom and dad, my husband, my work family, they've supported me through all of it. So.
Oh, that's so nice to hear.
Yes.
Well, keep on doing what you do,
Yes.
and thank you for what you do.
Yes, thank you very much. Quite the pleasure.
Well, congratulations,
Thank
Tricia. We're so thrilled to have you as one of our top 5 nurses of 2020.
Perfect. Thank you. Thank you very much. This was a great honor.
So there you have it, the class of 2020. Our event was brought to you by Unity Point Health Sioux City and sponsored by Floyd Valley Healthcare, Mercy One, Morningside College, Briar Cliff University, and Siouxland Community Health Center. Be with us in 2021 when we honor another great group of people. We hope to be back at the Delta Hotel and bigger and stronger than ever. Thank you for being with us now, and the next time you see a nurse, be sure you say thank you.